Welcome back here to Fox 51 today. Trinity Mother Frances just launched its biggest project in its 75-year history. John Moore is here to tell us all about it. John, this is something that's really going to change the way people go to the hospital, the way they can communicate with their physician. This is really embracing technology in a whole new way. Why is this the biggest project for Trinity Mother Frances in 75 years?
Well, I think number one, because as far as manpower and finances, it is the biggest project in our 75-year history. This was a $60 million investment, and we had 70 people working night and day for over a year to implement this. But you're right, it's changing the way that we interact with our doctors, with our providers. The old way that we've always done it is you go in and you have your appointment and you have your tests done, and then you wait for your labs, and somebody either calls you on the phone or you get something in the mail and you wait for that letter. This way you can log in securely through your own portal online through MyChart and check all of those things yourself. You can communicate with your doctor's office, ask questions, you can make appointments. We're talking about scheduling, billing, all of these things that we normally would have to do through paperwork, we can now do online.
Well, and you just laid out a lot of great reasons why this benefits the patient, but let's talk about that more in depth. I mean, if a person is not familiar with technology, they don't get on a computer often, and they're saying, wait a second, now I'm going to be so confused. Explain how ConnectCARE will still benefit that person.
Well, I think you're right. There are a lot of people, like my parents, for example. You know, my dad is very into the technology, my mom not so much. So people like me who grew up with technology are going to be able to get on and help our parents or help our kids or our children or whoever it is. There's always somebody around us who does understand the technology, and that's the beauty of this. If you choose to have someone help you log in and help you manage your health care online, you can do that. We're not going to do that. We're trying to keep this secure. So the big question is, how do you get started? Well, the next time you're in your Trinity Clinic physician for a visit, next time you're in to see that doctor, you ask for your PIN. They'll give you a PIN. Then you can go in and set up whatever you want your password to be. Okay. But we normally are going to do this in person. We're not going to do this by phone because we want to make sure it's really you.
Certainly. Well, I wanted you to talk about the MyChart part of this electronic health record.
Kind of touched on that a little bit already, but essentially it's this. MyChart is the portal that you go through to check all of the things we discussed, like your lab results, your test results, to make an appointment, to check on your bill, things like that. MyChart is a free app in the iTunes store. Also, if you have an Android phone, you can download an app, and it is, as I said, absolutely free, but you're going to have that PIN. You can also log in through MyChart online. You can go to our website, which is tmfhs.org, and just look for MyChart and you'll find it, and you can click in once you have your PIN there.
A lot of the talk, of course, even in the debate last night about the Affordable Care Act, also known as Obamacare, and a lot of that talk was about electronic medical record keeping. Trinity Mother Frances has already had that, essentially. This is just a whole different level of electronic medical record keeping. John.
You're absolutely right. We did this about 10 years ago in our clinic division because it was the right thing to do. So we've been investing and go in this direction because we knew it was what we should do. It's good. We think it's good that everybody is going to this system, because once everybody is on an electronic health record, we can all talk to each other, and that's the beauty of an EHR. It's going to take several years for that to happen, but that is the direction that we're going. The reason that our system is what we think and consider to be the best is there are more hospitals and healthcare providers in the United States on this system than any other. The reason being, it wasn't an existing piece of software that somebody built on top of. It was actually built from the ground up to be integrated through a clinic division, a hospital division, billing, scheduling, test results, and it's a company called Epic, and that's who powers our system, which is called ConnectCARE.
Well, John, quickly, I know people can go to tmfhc.org/MyChart for some more information. There's a lot of information out there. It's always a pleasure to have you on,
Ben,
John.
thanks for having me.
Thanks so much for coming here today. We greatly appreciate it.